All right, Sam, do I have the okay to start? All right, it seems like I got the kickoff to start. Again, good afternoon, everyone. My name is Alazar. I have the fortunate opportunity to really be able to be an educator and teach young people about STEM. But more importantly, I get to do that at Biogen. So I get to run the Biogen Community Lab with my buddy Connor, who's also my associate, who's been working with us to really drive this initiative of STEM education, but more importantly on the biotech sphere. And then we also have my colleague Alex, who also we will introduce in a little bit, who also does a little bit of that work as well. But I do want us to go to the next slide if we can, because I want you guys to see who we are outside of this sphere that we're in. I want to introduce you guys all to Secretary James Peyser, who'll be joining us, and we also have Kiara Sterling. So before we start into each individual speaker, I want to thank you guys all for joining us this wonderful afternoon to talk a little bit about STEM education. You know, I said earlier that STEM education is so important to the state of Massachusetts, and it is such an important factor to include into everything that we touch and do, especially in Massachusetts, given that we are heavy on life sciences. So without further ado, I do want to give a warm welcome to the Massachusetts Secretary of Education, Jim Peyser, who directs the state's Executive Office of Education, which oversees early education, kindergarten to 12, and higher education. He is Governor Charlie Baker's top advisor on education and helps shape the Commonwealth's education reform agenda. He will make some remarks about the importance of STEM education, not just for our strengthening of the economy, but for opening doors to opportunities to our young people like yourselves, and for those who are parents who are joining us, as well as for the community overall. And so we really, really appreciate your presence here. And I know that we'll also be tackling the discussion around underrepresented students in STEM as well. So let's hand it over to you, Secretary Peyser.
Great, Alzar, thank you. You framed my remarks very well. In fact, maybe I should stop right there because I think you really touched on the main points that I wanted to bring up. But thank you for hosting this event. Thank you to Biogen, obviously, for making this possible and for all the great work that the company is doing to support STEM education in the community. As already been said, this is STEM Week, and like last year, the theme of STEM Week is See Yourself in STEM. And the reason we're doubling down on that focus is the reality that our rising generation of students and young adults is increasingly diverse. So in order to give them the opportunities they deserve, and in order to fuel the growth of the STEM-related occupations and businesses in every region in the Commonwealth, we have to make sure that in both school and in the workplace, STEM is a welcoming and inclusive, especially for people of color and women who, as you all know well, have too often been underrepresented in the sciences, technology, engineering, and math professions. We also have to make sure that underrepresented youth are able to see a viable and exciting path forward into STEM occupations. And we need to broaden their perspective to see that rewarding STEM careers exist everywhere across the Commonwealth in a wide array of industries, obviously including fields like biotechnology and life sciences, which are particularly important to Massachusetts and critical to the effectiveness of our broader healthcare system, especially in this time of COVID. In doing so, we need to introduce young people to professionals in the field who have already successfully made the journey into STEM careers and who can serve as role models and mentors for the next generation. And of course, we need to give students an opportunity to do real STEM work in a real STEM environment while they're still in school through internships and co-ops, while providing them with engaging pathways and learning experiences in the classroom and in places like the community lab that include virtual simulations of real-world environments that allow them to use their STEM knowledge in real-world applications. So this is, as I understand, hoping to learn more, this is the work of the community lab. This is very much what Biogen is trying to accomplish in its community engagement. And it is why the community lab is so important. Events like this one is so important. So I want to thank you for letting me be part of it. I want to thank you for hosting this event, and I'm looking forward to the program.
Excellent. Thank you so much for joining us. And we have you for about an hour and a half, so we'll see what we can do, and we'll get talking in just a few minutes. But before I do that, I want to introduce also Kiara Sterling. Now, Kiara Sterling is the executive director of the Massachusetts Black and Latino Legislative Caucus, a group of 14 legislators that is the voice of and dedicated to serving Massachusetts communities of color in the legislature. Chiara will discuss the importance of STEM education in these communities as well as their work with Biogen. So Chiara.
Yes, thank you so much for having me. I'm so glad to be here, and I come with welcomes and hellos from all 14 of our members who wish they could be here, but we want to express our thanks to Biogen and Lemelson-MIT for all their work putting this together, and to the secretary for kicking off what's set to be a really fantastic ME STEM week. So as was noted, I serve as the executive director of the Black and Latino Caucus, which is 14 members. And I always emphasize that it's just 14 because the strength of the caucus is really one of few. And it always demonstrates that even though there's a few of us, the power always exists, what you're able to do through collective work. And, you know, that ranges from anything from filing legislation to trying to get budget priorities passed to building community partnerships like this. And we are so thrilled to work so closely with Biogen through their community lab effort, because I think Biogen is a great example of what a global corporate sort of force can do when they have such a local impact. And I think it's a really good reminder that all politics is local, and at every opportunity and in every scale, we have ways to meaningfully engage in serving the underrepresented and the disenfranchised and the marginalized, which is what the caucus always tries to do. You know, we fundamentally believe that you cannot be what you can't see. And so much of our work and so much of what fuels the initiative of the Biogen Community Lab, which is why we're so thankful to be a part of it, is that it's meaningfully opening some doors and helping students understand, and teachers as well understand, that pathways exist and opportunities for mentorship exist. And, you know, at this time in our nation's history, where we're kind of, you know, wrangling with a historic and unprecedented moment with both with a pandemic on one end and a sort of what I'm calling racial Armageddon on the other end, there are so many needs and avenues for us to understand and actually show up for equity in real ways. And the importance of STEM is really something that's emphasized in the reality that there is no room where conversations are being had, or no lab where ideas and creations are being generated, that Black and Latino or women or people of color writ large should not be in, because we understand that it's not about us not having the ideas or us having the interest or the expertise. It's sometimes just that we need a little bit more resources and we need a little ladder, because we understand that the barriers that our communities face are something much different than others. And so we're really grateful to Biogen to help our students and help our teachers fortify some really meaningful, long-lasting pathways that help our students grow into careers in the STEM fields that have amazing lasting impacts on the world that we live in, and way outside of the biopharmaceutical or biotech industries. But primarily today and this week, you know, we're really focused in that, and the role that, you know, these conversations about creation and scientific ingenuity and innovation, whether that's in engineering or technology or mathematics, we understand that all of those conversations play a significant role in the world that we're collectively building together. So that being said, I just want to say another thank you, and I am so excited to see what a virtual lab is like. And I'll kick it back to you, Alizar. Thanks.
Excellent. Thank you so much, Chiara. So, you know, I want to introduce you guys to my next set of colleagues. I think it's so important to also introduce you guys to the instructors of the day. So, Alex, if you can, let's kind of enter into that next slide there.
We can just introduce ourselves. Our slide got
perfect.
arranged.
I'm going to let you,
You guys can see
Alex, introduce yourself too.
Sure. So, hi, everyone. I'm Alex Cameron. So, I'm an instructor with the Biogen Community Lab. I work in the community lab that is based in Research Triangle Park, North Carolina. So, a little bit south of most of you that are on this call today. But I'm really excited to join you, and we're going to talk about biotech and Biogen, and we're going to have a lot of fun along with my colleague Connor. So, Connor, if you want to introduce yourself.
Everyone, my name's Connor. I am like the Alex of Cambridge. So I get the pleasure of teaching with Alazar. And if you got to see Alazar talk yesterday or heard him talk today, he's a treat to work with. And I mean that, Alazar. And I hope we're going to have a lot of fun today.
And then tell them what you did a few years ago before starting in the community lab.
Oh, yeah, I always forget about that. So actually, back in 2015, when I was I think just about to graduate high school, I attended the community lab program, and Alzar was my instructor. And then a few years later, I reached out, and then he set me up with an internship, and I just kept coming back, and he never got rid of me somehow. So yeah, I started all the way back in high school with Alzar, and here I am now.
You know, it would have been really cool to actually have you be the interviewee in this particular case. But what we're going to do is I'm going to bring Chiara and Secretary Peyser, and if we can just talk a little bit about what your perspective is on what the future holds for STEM education and where we're headed from both the legislative perspective and from the educational perspective.
Well, that's a big question. I mean, I think just a couple of things, and some of which I sort of at least indirectly referenced in my opening comments. You know, I think the push in STEM education is towards applied and trying to move more and more towards creating curriculum, creating learning opportunities that engage students more directly in doing STEM as opposed to just learning about it. Now, I'm one who believes very strongly that these things are mutually exclusive. It has to be a both and. You can't apply, you need to have STEM knowledge in order to apply it, but you just have STEM knowledge in a vacuum. You need to have the kind of experiences that allow you to put it to use, especially around things like engineering and technology. These are areas that are sort of hands-on by definition, if you will. And we need to give students more opportunities to experience these subjects in that way. And a couple of things. One is it means we need to have more the curriculum that we develop and the course of study that students pursue over time needs to be more tightly integrated with those kinds of experiences. So that it's not just a one-off, like let's go to, and I don't mean in any disrespect here, but let's go to community lab next week, and then we can check the box and say, okay, we've had our applied learning experience. Now we go back to the regular classroom. It needs to be more part of a coherent and integrated aspect of what their instruction and what their learning is like in STEM field. And then the second thing, and this is very much obvious, is we need to engage employers. We need to engage other organizations that are actually doing work to open their doors and let students in to see what it's actually like on the inside, what the opportunities are like, what the people are like, so that they can start to see themselves, and that's a, you know, to bang on the theme for the week, but also that they can start to see a pathway for themselves, so that this isn't, you know, again, something you do in school or in a classroom with a teacher, but it's something that you can build relationships with, you can find mentors, and you can pursue a career in. So anyway, I think it's, again, really applied learning about these partnerships with employers, about creating pathways that they can follow.
Very well said, Secretary. Chiara? I think you might be on mute.
Sorry. Yeah. Yes, I would echo so much of that. And, you know, again, when we look at racial disparities in STEM fields, we understand that so much of that is happening, you know, at the college level, at the undergraduate level, when folks, you know, Black and Latino students are switching majors at rates that are much higher than their white peers. And we are led to understand that a lot of that comes down to mentorship. And so I think that it's exactly what the secretary said. about making sure that the learning is happening at a very early age and that it's experimental and hands-on. But it's also in making sure that those mentorships and those relationships that students are building at a young age are something that they can bring with them throughout their lives to the undergraduate level when they get to school, so that they understand that they are, they should be in those rooms, they should be in those labs, even if they're in overwhelmingly white institutions or surrounded by folks that don't look like them, right? It's a question about, how we are equipping students to understand their own potential. And so I think that, again, I know we're all here to just shout out the Biogen Community Lab because it's just so great, but it's a really fantastic model of what it means to meaningfully invest and take the time to talk to students and understand where they're at. And that's something that you can't put a number on, and you can't replace. And it's something that that students hold with them for a long time, that helps fortify a really important foundation for their careers.
Thank you so much. Again, I think we look at experience as something that's so great, and I think it brings so much value, especially for young people. Today I was actually on a panel with the John D. O'Brien High School over by the Roxbury Community College. And in that discussion, one of the students asked, is STEM very simple? Can I get from point A to point B, then get to point C? And will I enjoy my career? And so it was kind of a loaded question. And so when you hear questions like this, the one thing you want to take a step back on, especially as an educator, is it's not about where we want to be per se of, will I enjoy it? It's more of, do you see yourself waking up every day to enjoy what role you'll be having in that particular area, especially in STEM? And so I think that was kind of the push. And it's all about the experience. They can't be something they haven't seen, or they can't be something they haven't actually touched or participated in. And so these are such important conversations to have within these school districts, as well as inside of the classrooms and individual levels as well. And so we're very humbled by the fact that we get to do that at a very, again, one-off opportunity, but also on a one-week session as well. But, one of the things I'm hearing from you, Secretary Peyser, is that it's not enough. These exposures are not enough. They need to be more. They need to be embedded into the school. They need to be embedded into the discussions in the classroom. And I think if we keep pushing, I think eventually it will definitely happen. And I know that with Lemelson-MIT and their thoughts of really thinking about problem solving and kind of having these transdisciplinary models are also important. So I know that we're also talking a lot about that. So with that being said, I'm going to turn it over to you, Alex, if that's okay with you. Thank you guys so much for answering those two questions. And I know those are not easy questions to answer, especially in the field of education that's just always constantly going back and forth. But I truly appreciate it, and it means so much to us as well.
Absolutely. My pleasure.
Yeah, likewise. Thank you.
All right, Alex, take us away.
Awesome. So, so you've heard us say, talking about careers in STEM and talking about students finding careers in STEM, and we use this word biotech, and the seminar is literally named "The Wonderful World of Biotech." So, what I want to do for a few minutes is talk about what that means. What is biotech? What are these careers we keep saying we want these students to get into, and what does that mean for Biogen? And what kind of careers do we have? I want to talk about that for just a little bit so that you kind of understand, what opportunities are out there and what it literally means to be in a biotech career. And then we're going to get on to our activity, which is going to be a lot of fun. So I want you guys to know that during this part of the presentation, feel free to use the chat feature. I'm going to be asking some questions. I'm going to be explaining some things. If there's something you don't understand, put it in the chat. Answer me if I ask a question in the chat. I want this to be as personal as possible. So just use that chat feature and let's have a good time. All right. So I'm going to start by quizzing you all. So biotechnology, that's what we're here to learn about, right? The wonderful world of biotechnology. What does that mean? So if you want to use the chat, you can click your 1, 2, 3, and 4. So at its essence, biotechnology is the use of blank to develop or make useful products. Is it number 1, living organisms? Is it number 2, nucleotides and DNA? Is it number 3, high-tech machines? Or is it number 4, your biology teacher's awesome skills? So when you think about biotech, what are biotech companies doing? What are they using in order to be considered biotech? I see one answer. Someone thinks it's number one. I'll give you guys a couple of seconds. I have a couple of number ones. Oh, we have a two. Okay. Another one. Oh, here comes some more ones. Okay, I'm going to give you the answer. So it is one. So when we think about the word biotechnology, you can break that word up, right, into bio and technology. And bio means life, right? It means, you think about biology, the study of life. And technology is just when you use something for a practical purpose. So you can think of it kind of like a tool. So it's really when we use life, when we use living organisms in order to have some sort of tool, in order to do something useful for society. So that's really at its base what biotechnology is. So when you think of things like, I don't know, like aging cheese, where they use bacteria to age your cheese, that's biotechnology, right? They're using a living bacteria to do something useful. So biotechnology is really a huge, broad world, and it's really exciting, and it's something that we want you to know exists. But we want to talk a little bit more specifically about what Biogen uses biotechnology for. So we call ourselves a biotechnology company. Why? What is it that we're doing? So next question for you. What is it that we do? Maybe you guys have heard about Biogen. Maybe you can just take a guess. It's up to you. But what do we do at Biogen? So do we make robots? Do we create new life forms? Do we discover and make new medicines? Or do we treat patients? So 1, 2, 3, or 4?
Oh, I know this one.
Threes. Alzar thinks he knows. I hope he does, since he works at Biogen.
I say, I'm pretty sure you like made this, so I hope you do.
Would be weird if he didn't. Okay, I'm seeing a lot of threes. You guys are with it today. It is 3, right? So we're using biotechnology to discover and make new medicines. So now you're saying, okay, Alex, that's cool, but like you just told me that you use living organisms. What do you mean? Like, what is all that about? So I want to show you a slide really quick. This is 2 pictures of 2 different molecules. So you see this molecule on this side that says it's a protein medicine. And then you see this other molecule that's aspirin. So maybe some of you have taken aspirin. It's a pretty common pain reliever. So these are 2 different molecules, and they're made with 2 different processes. In the chat, can anybody tell me kind of what differences do you see between these 2 molecules? Anybody see any differences between a protein medicine and aspirin? One is much bigger. Yeah, the protein medicine says it's made of 20,000 atoms, and the aspirin is 21 atoms. So protein's a decent bit bigger, right? One has more atoms than the other. One's more small, one's more big, one has more dots. Absolutely. So when you look at this protein medicine that's made up of these 20,000 atoms, it's really complicated, right? It's a lot of different things that have to work and a lot of different interactions that have to happen. With the aspirin, it's a little bit more simple. It's only 20 atoms. They're all kind of there together. So I'll give you kind of a background here. So when they go to make aspirin, what they're doing is a chemical reaction. So they just take some chemicals, they add them together. It makes the aspirin. They maybe like purify it, press it into a pill, put it in a bottle, send it to the shelves of your grocery store. So that's what they're doing when they're making aspirin. You can actually, when you get to college, oftentimes you'll make aspirin in one of your college labs. It's really not that hard. Do you think it's harder to make a protein medicine? When you're thinking about 20,000 atoms, you think that's a little bit harder to make? Alzar's nodding his head.
I'll give the head nod and say absolutely.
Yeah, I'm seeing some yes in the chat. Yeah, so protein medicines are what we're making here at Biogen. It's a lot harder than just, throwing some chemicals together in a flask. So how do we do it? That's where biotechnology comes in. And this is where we use those living organisms to be a tool for us. So what we do is we take DNA. So we take a disease that, is affecting people, and we look at maybe that they're missing a protein. They need a protein medicine. So the first step is to figure out what protein they're missing and what DNA corresponds to that protein. So once we have that, we have this DNA, which is literally like a recipe that says, this is how you make this protein. So we can take that DNA and we can insert that gene, that piece of DNA, into a living cell. And what's really cool is that what happens next is that these cells, as long as we keep them happy, we keep them fed, we keep them kind of like pets, they will make the protein for us. So just like cells in your body make your proteins, we can actually use cells that we grow in flasks to make proteins that can be used as medicines for people that maybe their body doesn't make the protein. So it's a really cool way to make medicine that is, it's exciting and it's a little bit a newer way than something like aspirin. So it's really kind of where we meld this bio and this technology together. We create these medicines, this new technology with these living organisms that we get to grow and we get to sort of manipulate into helping us help people. So we need to grow a lot of cells, right? Because we need to make a lot of protein to have all this medicine. So really what a lot of the people that work at Biogen, specifically down here in North Carolina, it's where most of our manufacturing take place, a lot of their job is growing these cells, making sure these cells stay happy so the cells can make the proteins. So this may be a job you never even knew existed, right? Growing cells in a flask. It's actually the job I did before I started teaching here. So it's a really exciting thing to get to do, where you get to grow these cells, you get to figure out what they need, and then they make these medicines for you so that you get to help people. So at Biogen, the reason we're doing this is to help people. I mean, that's really kind of what this is about. And our mission is neuroscience. So we're making these medicines for diseases that affect the brain, diseases that affect the nervous system. So things like Alzheimer's, multiple sclerosis, Parkinson's disease, these diseases that are really pretty bad for people that have them, and they often don't have a lot of medicines. But using biotechnology and using this new way to create these protein medicines, we're able to bring medicines that have never been seen before and help people that historically didn't really have a lot of help with these really bad diseases. So that's kind of a background into what we do at Biogen and how we use biotechnology and how maybe one day you could use biotechnology in your career. Then I want to talk just for a second about what we, literally me, Connor, and Alizar, do at Biogen. So obviously we're not in the lab growing these cells and we're not making these medicines. Our job is a little bit different, right? Our job is another part of Biogen's mission. So, I mean, at its core, Biogen's making these, these medicines for neurological diseases and they're helping patients, right? But there's also other things that Biogen's passionate about. And one of those things is giving back to the community. And that's what we're here for. So you can see on this slide, we have things like volunteer days where employees get to volunteer. We have a Biogen Foundation that gives money to STEM education and nonprofits. But what we really want to focus on today is the community lab. So that's where we all work. So we're a little biased. I think it's the best part. But you can see on this slide that since our community labs opened, and the first one opened in 2002, we have seen 53,000+ students. So it's really exciting where we get to meet students like you. We get to teach you about the types of careers Biogen has, and going back to what Kira and Mr. Peyser was saying, it's really important to us that everyone gets this access and that everyone learns that you can do these jobs. You can come work at Biogen. You can grow cells and make medicines and help patients, no matter what your background is. And so that's really kind of what we're here to do and what we've been doing since 2002. So what I want to tell you about for just a second, so we can kind of segue into our activity, is how we decided to teach you virtually. So you guys may imagine that we actually have physical labs. There's one in Cambridge, Massachusetts, and there's one down here in RTP, North Carolina. And so normally the way it works is Connor or I or Alizar would be standing in front of the class and we'd be teaching you and we'd be showing you instruments and we'd be explaining all these things and letting you touch it. It would be really exciting. And that's what we've been doing for years and years and years. So every summer we do a summer program where we bring in students and they choose to come like learn about really cool science during their summer break. And we get to spend a whole week with them and we get to do all these experiments and it's really fun. And so 2020, that's what we were planning on doing. That's what we do every summer. But as everyone here knows, 2020 has a mind of its own. And it decided maybe that wasn't going to be how it was going to look this year. So if you had the pleasure of joining us yesterday, you got to hear people talk about our summer program that we did this year and how we took our program virtual. So I'm not going to spend a ton of time on it, but I'm going to share this one slide and just give you a little brief explanation. So we had this program that we called Biotech in Action, which is kind of exciting in itself, right? We were like, we're going to make this virtual, but there's still going to be action. We're still going to learn about biotech. We're going to get involved. We're going to have fun. And so that's what we did. We took 400 students, broke them up among several weeks, and we learned. We learned about biotech. We got to learn about Parkinson's disease. We learned about all the different types of careers and all the different things that biotech kind of encompasses. And to do that, we had to think outside the box, right? And that's where our partnership with Lemelson-MIT came in. So they stepped in, and we reached out to them. We knew they had some virtual teaching sort of experience. So we partnered up with them. We figured out everything kind of from scratch as how in the world we could teach virtually. And one of the cool things that we learned is there's a ton of software out there and there's a ton of resources that help you learn and help you get exposed to these things without necessarily having to be in a lab. So we used a lot of different software. We had a really fun time. And that's kind of what we're going to do today. We're going to give you a little snippet of that just so you can see how you can sort of learn and figure out what's going on with these careers in this industry without ever having to actually step in a lab, which is pretty nice in 2020, right? So the software that we're going to use today is called Labster. Labster it's a really fun software experience. You can use it through your just like web browser. You don't have to have a bunch of like fancy things, but it offers this virtual laboratory experience. And obviously that's not the same, right? It's not the same as being in a lab, but there's honestly pros that it offers that are different than being in the lab, right? So when we think about it, it's pretty realistic. We, Connor and I and several of the Lemelson-MIT people spent like hours this summer before our program going through these simulations, making sure that they, showed science the way it really is. And we were just blown away because, I worked in a lab for 6 years and I worked with a lot of these instruments and I would see them on this Labster and they looked exactly the same. They worked the same, you clicked the same buttons. So it's a really realistic experience of what kind of goes on inside of a lab. It allows you to practice, right? You can do it over and over again in a real lab. Stuff to do that's kind of expensive and maybe, you don't want to be in the lab all the time. You can do this at midnight if you wanted, right? You can just be in there virtually practicing your lab skills over and over. And it's pretty fun. It's kind of like a video game. You're clicking around, it engages you. But importantly, it's risk-free. So, when you're in the lab, there are risks, right? There's safety precautions that you have to take. There's also, like I say, there's like reagents that cost a lot of money that you have to keep buying and things like that. So that's completely gone when you think about this virtual lab. So it's a really cool space to get to learn and sort of show your interests and see if, there's things that you like to do within kind of your computer. So that's what we're going to do today. We're going to use this Labster technology to learn about micropipetting, which I'm not going to spoil too much because it's going to be really fun to learn about. But you guys are going to get to see how you can use, all kinds of resources that are available to you to explore these different things that maybe you're excited about. Maybe you're excited about science and you're excited about biotechnology. So we're going to explore that a little bit today over the computer without ever having to actually go to a lab. So it should be really fun. There's one hand raised, so I want to see if you have a question, if you could put it in the chat. If not, okay, hand is down. So, but if you do have a question, if anything pops into your mind, feel free to put it in the chat. I'm watching it, so we can help you. But for now, Alzar, do you want to take it back over for a moment before we go to Connor and our exciting lab simulation?
Yes. So I want to take this time to see if there are any questions that you, as guests, may have for either ourselves at Biogen, or for Secretary Peyser, or for Chiara, or for Lemelson-MIT even. So we would be happy to kind of address some questions. So I'm going to open it up for you guys to ask questions. You guys can ask about our programming and some thoughts and some ideas you may also have for us.
Awesome.
I'm not seeing anything.
No.
I'm not seeing anything
Dun,
either.
dun, dun.
People are ready for this lab simulation.
Oh.
Okay, there is a question. I might have missed this, but will we be able to see a recording? So this is being recorded. And I think that will go up on our website. So we'll be putting it on our website relatively soonish, as long as, as soon as we can get it, the logistics of putting it on a website. I don't know, I'm not an IT person, but it will eventually be on the virtual community lab has a website at Biogen. So you can search for Biogen Virtual Community Lab and it will be on there. And then there's another question, what fields do you work in? Oh, I love this question. So when we think about Biogen, you may imagine, because I just told you that we have a lot of scientists, that we have some scientists that work here, right? So when you think about that, there's chemists, there's biologists, there's engineers, there's all kinds of scientists. But do you think anybody other than scientists work at Biogen?
See if
Anybody?
people can drop some.
Yeah, put it in the chat if you can think of any other fields that maybe Biogen has careers. Inventors. Yeah, absolutely. There's people that are coming up with all kinds of awesome inventions in biotech.
You pretty much can't be wrong unless you say like firefighter or something like that.
Engineers, yeah, there's a lot of engineers. So when you think about, we talked about how we have to grow cells. There are all kinds of engineers that their whole job is to figure out what kinds of containers to grow the cells in, what temperatures to grow the cells at, what to feed the cells. It's a lot of really fun trial and error. Lawyers, I see in the chat. Do you guys think we have lawyers that work at Biogen?
Yes, we do.
We do, absolutely.
We have tons of lawyers.
We have tons of lawyers, right? We have medicines that we're making that need to be copyrighted. We have, all kinds of reasons why we might need lawyers to work at Biogen. Chemists, yeah, for sure.
Then another big job, especially in today's current times, we need IT people more than ever.
Absolutely. I just told you that I'm not an IT person, which is very
Same
good,
over here.
but I need a lot of IT help. It's a miracle I'm on this Zoom today with you. So yeah, we have a lot of IT people that work at Biogen to help all of the systems run, right? Everything's computerized now. Even how we grow our cells and make our medicines, there are computers involved. What kind of scientists work at Biogen? All kinds of scientists. So there are people that have bachelor degrees, there are people that have master's degrees, there are people that have PhDs in almost every field of science. There's so many different parts that go on. So before I started teaching in the community lab, I actually worked in what's called the quality control department of Biogen. We had this whole building where our whole job was to test the medicines and make sure that they were made correctly and they were working correctly. So we literally had, microbiologists and virologists and chemists and biologists and all kinds of different people working together to test these medicines. And that's just one tiny building at one tiny site. So there are kind of all the different types of sciences you can imagine are doing something at Biogen. Do you test medicine on animals? We don't have any animals down here in North Carolina. I don't know if you guys have any in Cambridge. Maybe Alzar can answer this.
So typically in R&D, mandated by the FDA. Anyone know what the FDA stands for? Anyone?
Ooh.
Anyone? What does the FDA stand for?
No. All right. Appreciate the honesty.
Anyone know? FDA, letters F,
There we
Food
go.
and Drug
there we
Administration. Someone already threw it on there. Perfect. So yes, so the Food and Drug Administration doesn't allow us to proceed from research into development and into people without actually trying it onto certain organisms. And that's kind of a very, very important part of what the FDA guidelines are. So we have to follow that, and we really do follow it with ethics. I think that's the one thing I want to tell you guys. When I used to work with organisms, it was so important for us to understand that these particular time points in which we were researching has a greater good, and that greater good was always to make sure that we were, one, very safe with the organisms, but also on top of that, we were really, really cognizant of the fact that they are contributing to the overall science and understanding as well. So great question. Very tough for us too, I think, as scientists to really be able to look at that. So it is a very, very difficult question to answer, especially when we are in this time, but it's just a part of the guidelines that we have to follow. So great question.
Yeah, and on that same line, when we're thinking about biotech, actually a lot of the testing now we can do directly onto cells. So we can grow cells and then we can do the testing on the cells instead of having to use animals. And that's kind of a newer thing in biotech that maybe if you guys go into biotech, you can work on even more, is how to take the testing kind of away from animals and into like human cells that you grow in a flask so that you can see exactly how the medicine is going to work. So that's something that's kind of really exciting when we think about biotech and the future of biotech. Let me see, do we have any other questions before we move on?
What college did you attend? Was it really
What
cool
college
one?
did I attend?
Yes, I think that
Ooh.
you were the
I
top at that
attended
time.
UNC Chapel Hill. Go Tar Heels. You guys basketball fans? Yeah.
Ooh.
I'd have to say Northeastern Huskies all the way.
And I went to the University of New Hampshire because I'm from New Hampshire and I have not left New Hampshire apparently. But I still work in Cambridge. Alzar gives me a lot of fun jokes for that. It's always great.
So it's wonderful to have a great set of colleagues who really, I think, come with different perspectives of what school and representing different mascots. But I think we all went into the field of science. So it's been really, really humbling to talk about the science work as well. So I'm going to kind of do something a little differently right now and let Secretary Peyser or Chiara, if you have any other input you would like to have, please feel free to join us in this discussion. If not, we're going to go right into the labs or simulation so that we can have you guys have some time to look at the simulations, and then feel free to kind of just see how that interaction works. If you have questions, we're also going to throw our email. So can we have communitylab@biogen.com on the bottom there? If you guys are interested in getting in touch with us, if you have never heard of us before, we really want to hear from you guys. And if you also are interested with Lemelson-MIT and then really wanting to see what they do, I'm sure Lemelson-MIT will also throw their email in there as well. And we'll get back to tell us that you saw us on October 22nd, because we love hearing from teachers, we love hearing from students, and obviously we want to get you guys excited about STEM and making sure that you guys are preparing for the future of STEM education and where that's going to take you.
Alzar, thanks for letting me in. You really appreciate it. This is really fascinating, and you're all doing great work, and I love your enthusiasm.
Well, thank you so much for joining us, Secretary Peyser. It's really important to us that, I have a horse in my throat, and I don't know where that saying comes from. But it's so important that you're able to join us. And I think for being able to oversee the entire state's infrastructure on education, and then even taking the time to come talk to us, I think that means a lot to us as an organization. But more importantly, I think to the students and to the listeners and the viewers, I think that also should resonate a lot with the fact that, you are fighting for STEM education in the state. And it's so important to really be able to do that. So we thank you so much for joining us.
Well, I really appreciate it. Thank you all for the great work that you're doing.
And we will send you a Labster link at one point, so you can also manipulate stuff on your virtual world
Excellent.
one day.
Excellent. Can't wait. See you soon. Bye.
All right, we'll see you soon. Thank you. All right, Chiara, anything from your side?
No, I want to get right into this lab experience. I'm so
All right, Connor. All right.
All right.
The people have voted, Connor. Let's do it.
It looks like there's a question for you after, though, Alzar. How did you start at Biogen? Because that's always a very fun story, too. So you can talk about that after.
Okay. I will stick around for that question at the end or while you set up the Labster, I can definitely start talking about it. Or if it's already been set up, oh, there it is. All right, perfect.
Yeah, as I had it ready for us. All right, guys. So let's go ahead and hop into the labs. Oh, let's shut the music off. So today we're going to be learning how to use a micropipette. And that's one of the key tools that we always use in biotech. If you go to pretty much any biotech lab, you're going to see one of those hanging around. It kind of looks like a weird looking needle, but like a little bit less scary. You can kind of imagine it like a turkey baster if any of you guys like cook with turkey basters. I don't think I've seen one of those in like 10 years at least. I don't know why, but they kind of look like they kind of work like that. So you're going to squeeze the plunger at the top, and it's going to push air out of the instrument. And then when you let go, it's going to pull air right back in. But in the terms of the turkey baster, that's not very accurate. It's kind of just like picking up some random amount of liquid and dumping it. But these actually allow us to be very, very accurate up to the microliter. So in the chat, does anyone know how many microliters fit into 1 liter? So if I had like a 1 liter jar, I had this 1 liter beaker right here, you know, because science nerds, right? How many microliters would fit in here? And it looks like someone said 1 million. Yeah, so a couple people said 1 million, so that's definitely it. So 1 million microliters fit into 1 liter. Imagine trying to measure that tiny, tiny amount. Imagine trying to fit like 1 million of these tiny, you know, water droplets into a glass beaker, right? They have to be very, very small. Yeah, so there's about 1 million microliters in there. And let's move on with the lab and talk about that. So we're working with a thing called a Bradford assay today, and that's kind of like our purpose for using the micropipette, the reason why we're learning to use that. And the way this works is we're going to be working with proteins. So the very first step is we actually have to dilute some of the sample. And don't worry, I'll quiz you guys on some of these. There's just a lot of questions, so I don't want to hold up too much of that time. So we're going to be diluting a sample. So if anyone knows what dilute is, it means to kind of like take something that's super concentrated, something that's like super strong, and then just add water to it to kind of make it less strong, right? And the protein concentration that we have is too high, so we need to lower that with water, sterile water, or in this case, if we were using buffer. And buffer is just kind of a solution of water and different salts that kind of help keep reactions stable. So if we look at our desktop or our desk, there's 3 different pipettes here. There's the blue one on the right, which is the P1000, the yellow one in the middle, which is the P200, and then the one on the left, which is the P20. Now, all of these things mean that they measure different amounts of liquid, with the P1000 obviously being the largest one because 1,000 is the biggest number. And then you go all the way down to 20 microliter, or the P20 pipette, which I think measures down to, I think it's 2 microliters, if I'm correct. Oh, Alex,
You are
shaking your head.
correct.
Good. Thank you. All right, so we have a range from 2 microliters all the way up to 1,000 microliters, which would be 1 milliliter. And we actually have a pipette in the, the physical lab that goes down to 0.2 microliters. So that's 200 nanoliters. So it's even smaller, crazy stuff. So I will pick up my micro pipette and we're gonna go over how to kind of use that. So we're gonna be working with these things called sterile pipette tips. And the reason we use these things called pipette tips is because we need to protect these tools. So in the actual lab, each one of these pipettes costs about, I think, $300 each. And in at least our lab, we have 8 times 4, so 32 pipettes at each table. And then we have some backups somewhere kind of hiding around. And we have 8 tables. So there's a lot of pipettes in our lab. That's kind of incredible. So we need to make sure we keep these things very clean. So we only use these sterile pipette tips to avoid contamination to the sample. It'd be embarrassing if I got these wrong. I should know how to do all this stuff, right? All right, so these blue pipettes use the blue pipette tips and the yellow pipettes use the yellow pipette tips. Not necessarily like that in our actual labs, but it makes it very easy to see right here, which is great. So we'll open up the box and we'll grab a pipette tip. And now our pipette is protected. All right, and now once we actually have our pipette tip on there and we're safe, we can actually go ahead and change the volume of this because we're not always gonna want the same amount of liquid. Sometimes we wanna make sure that we're changing it up depending on what reaction we're doing. So if we click on the pipette, you can use these arrows to change it higher or lower.
Just because I'm also an instructor.
Go for it, Elzar.
I have a question on that pipette. So
Yes.
what the red 0 there?
Yeah.
What place value is that?
Ooh, that's a great question. So I'm gonna put this out to the group. So if this micropipette goes to 1,000 microliters and there's only 3 numbers on here, what do you think that top number, what do you think the place value of the top number is? This always gets a few people. It's always kind of like a trick question. What place value is that red number at the very top?
We have someone saying hundreds.
Oh, no, not quite. Think about how high it goes up to. So P1000. I'll kind of just.
Yeah, good job.
Yeah,
The
yeah. What are
thousands
you gonna
place.
We have a Connor in the chat saying thousands.
do? There we go. We have thousands place. Right, correct. All right. So this goes to the thousands place. So when you're going down the pipette, there's going to be the thousands place, the hundreds place, and the tens place, of course, because that's how the order goes. I remember that too. And we don't go down to the ones. So this pipette only measures up or as low as to the tens place. So we can do like, 310, 320, but we can't actually get any finer than that. And then we move over to this one. The place value would be 100, tens, ones, and then the next one would move down again. So it'd be tens, ones, hundredths with a th at the end because everyone always forgets the yeah. That's always my favorite. I always love that works. All right. So now we're just gonna go. So right now what we're doing is we're kind of exploring like the upper and lower limits of this pipette. So it's also very important to note this because if you walk into a laboratory and you pick up one of these for the first time and you know the upper and lower limits, it's kind of a really cool thing and instructors will be very impressed. Because if you go outside of that 200 to 1,000 microliter range, you're actually going to break the pipette because there's a bunch of gears and springs inside. So it's very important that when it says, if the limit is 200 microliters to 1,000, stay within that limit, or things can break and we don't want that. Because we'll
So
send the bill
this
to
is
your
an
house.
example of an invention that someone had to invent to help do biotech, right? We talked about how we need inventors earlier to know how all those springs work inside of this pipette.
Good call.
All right. And so I just kind of spoiled that one. So the limit of the P1000 is 200 microliters to 1,000 microliters. And then here's the range of the other ones. So it fairly consistent, always starts with a 2 or a 1. That's good enough. So the P1000 goes from 200 to 1,000, the P200 goes from 20 to 200, and the P20 goes from 2 up to 20. All right, so now we're gonna change that. So in the bottom left, as you're going through all these lab stairs, there's kind of like this thing called a lab pad, and it kind of keeps your progress, kind of tells you what's going on next. So right now it's telling me to set my micropipette to 800 microliters, which would read 080. And now I'm there. And here's a cool little example of what that means. So when you're doing this, you're just kind of filling in the places, right? So for the P20, there's the tens, ones, hundredths place, so on and so forth. And we usually draw this on the board, but right now we don't have a board. We have the Labster. All right. So how would you set the volume to the 20 microliters with the P20 pipette? So that's going to, can I go back? Right here. So if we have the P20 pipette right here, and we want it to read 20 microliters, we need a 2 in the top place, 0 in the other two. So it would look like 200. All right, and now the part that everyone loves to forget after they hear it for the first time and like the 5th time. So when you're using one of these pipettes, like I said earlier, you need to kind of push all the air out first. So when you do this, you're gonna get to this first very easy stop right here. It's kind of like the middle button. And you'll feel the pipette kind of come to a stop and you're like, okay, I have to kind of push further to get, I have to push extra hard to get through that. That's kind of your accurate measurement. So if you push down to that first easy stop, you're actually pushing out 800 microliters of air in this case. And we know that because we set it to 800 microliters. And then when we let go, it takes 800 microliters back in. If we go down to that second stop, that's not actually accurate. That's going to push out more air and allow more liquid to come back into your pipette, and you will not have an accurate reaction. That could be very bad, especially in the field of biotech. Everything's like to the T with like how exact it has to be. It's kind of creepy. So organized people, this could be your area. If you like to bake and like be exact to that stuff, And then to avoid bubbles, you want to make sure that you push all the air out before you get into the liquid, because if anyone's ever had like milk and you have like a straw, right, and you blow bubbles into the milk, right, it gets everywhere. We try to avoid doing that by pushing all the air out first and then going into the liquid. I didn't drink milk, but I saw my cousins do that. It's not my thing. All right, so what we'll do is we'll push this plunger and it'll go down to the very first stop, hopefully. I think I already did that. And then we need to get some of this buffer. So we'll click on the bottle that says buffer. It'll kind of go in there and take 800 microliters. And now when you're doing this, you want to make sure that you're going straight down into the into your little tube, whatever you're taking your liquid out of. Yeah, you just want to make sure you're going straight down. And you want to go, I believe this is saying like 3 to 4 millimeters below the top of the surface level. Yeah.
Why is it important that we do these things, Connor?
Oh, let me talk about that. Or does anyone know why it'd be important to not go all the way down to the very bottom of the tube? Anyone have any guesses why you'd want to stay towards the top of the liquid?
I can take a guess.
Go for it, Alzar.
Is it because if you go to the bottom of the tube, it could actually like squirt out of the tube? Because when you release it, that could be a factor.
Mm-hmm. Yeah, so if you guys think about it, right, if you have a very full tube and you're putting your pipette all the way into that tube, right, you're going to displace some of that water and it's going to come out, you know. So that could be one of the reasons. You could potentially get the pipette tip stuck at the bottom of the tube, so you're just getting some air in there, so you could have air bubbles and your measurement can be inaccurate. There's a bunch of things, so it's just it's easier to just make sure that you stay at the very top of that.
Yeah, there's a lot of like things that you just have to do with the pipette to make sure that everything's accurate. It's all about being accurate. You want to make sure you get the right amount and the amount you're trying to get every time.
Absolutely. Is there oh, there's a micro. So these tubes kind of hide. It's like you can barely tell it's there if you're like looking at it. That definitely tricked up some of our summer students. All right, and now you're gonna press the plunger all the way down to that second stop. So when you're in the lab, the second stop is okay when you're kind of getting rid of liquids. So if you go down to that first stop, there might be some residual left in the tip. Oh, well, that's what the question's answering. Look at that. I'm one step ahead of the game. So you want to make sure that you're going down to that second stop just to kind of get rid of any fluid that's left in there.
All about being accurate.
Right, and now here we are with the angles again. So when you're putting a liquid into the tube, you want to make sure you're pouring it at an angle on the side of the wall of the tube. The reason for that is if anyone's ever had like a soda or something like that, right? And you're pouring it into a glass, if you just pour it straight down, you could make a big mess. It could splash everywhere. But if you're pouring it down the side, it's kind of a nice, easy, gentle way down to the bottom. At least that's what I think of. I don't know if that's the correct answer, but that's what I've always told myself. Oh, okay, good. We're on the same page.
The liquid down.
Right. Okay, good. All right. So once we've actually, once we picked up the liquid, put it into a tube, what do you guys think we would do with that pipette tip after? Would we use the same pipette tip? We'd
use it again, wouldn't we?
No, Alex, we wouldn't use it again because that would be very unsterile. So there's this thing called cross-contamination. If any of you guys ever seen your parents cook, or if any of you guys do cook, I know we have a mix of students and teachers and other adults, but if any of you guys do that cooking stuff, it's very important that when you're working with like raw meats, you always keep that separate than like, vegetables and other stuff like that, because you can actually contaminate things with each other. So if we're working with like a bacteria sample in the lab, we could potentially contaminate everything with bacteria, and that would be very, very bad. So you always need to make sure that we discard the pipette tip. Oh wait, I clicked on discard the pipette. Discard the tip. Don't throw away our $300 tool. Throw away just the tip. So we'll click on the trash bin over here and we'll actually eject it because there's an ejector button on there in the front. Let me click it. There it is. All right. And now, once we know how to use this pipette, we can actually use it to make our dilution series. So we have extra tubes laying around and we're going to go ahead and do this. Okay. And then this is a quick question, kind of testing our knowledge. So how much protein would be needed? How much protein do you need to add to the 800 milliliters of buffer? So we add that 800 milliliters of buffer into the tube. So how much protein would we need to make it 1 to 5? I could not get those words out. I need coffee or something. Oh boy. Someone said 200. And that is exactly right.
Good math.
I didn't even get the chance to do the math in my head, so good for you.
Liliana is quick with her math.
All right, so now here comes a really good point. So we need 200 microliters. Now this pipette at the top of its range gets to 200 microliters, and this pipette at the bottom of its range gets to 200 microliters. Which one do you guys think would be best, or is there a difference? Which one should we use?
Ooh,
Alzar and Alex, you guys feel free to take a guess if you'd like.
Oh, you don't want us to guess. We'll give you the right answer.
I know.
But it's a very tough question to ask an audience. I think I'm waiting to see if they can actually think about it for a second. If I was to use a pipette to measure 200 microliters, which pipette would work best?
Right, think about it this way too. Would you rather have something, you know, all the way full, or would you rather have something that's kind of like a little bit full? I don't know if that makes any
Emelina,
sense. It made sense in my head.
Emelina says P1000. And I would have to argue the opposite. I would have to say P200.
Why would you say that?
Because P200 is more accurately designed to measure out exactly 200 microliters, right? And then if you use the P1000, it's accurately designed to measure out 1,000 microliters. So I would rather use the one that's already measured accurately to 200. And now
Right.
in this particular case, if you were going to, again, do this biology, right, in a biology lab, it's not going to matter too much. But in a chemistry lab, it may very well matter.
Right. If you need to be very precise, using an instrument that has a finer area of measurement, so this goes by ones, where the other one goes by tens, this one's much more accurate. Or it's a little bit more accurate. I don't know how much more accurate it is, but it's definitely more accurate. So we're gonna use this one. And we're gonna need a new pipette tip. So we're gonna open up the yellow box. In a normal lab, you would close these boxes after each time you're grabbing a pipette tip, which is a pet peeve of all the scientists in here. And that's just to keep them sterile from the outside world. So if you have any, like, you know, contaminants floating in the air, whatever. And we're gonna set this to 200. All right. We're gonna go to the start position. We're gonna go into the bottle that contains BHL, which is this one on the right. This is our protein. And we're gonna add it to that first tube that we added with buffer. And we're gonna push it all out. And now there's a quick animation of what's going on here. So we have our tube full of buffer and we're inserting that protein in there and we're kind of mixing it up. And this is the way that we commonly mix things up in microcentrifuge tubes. You just kind of slowly lift it out and put it back in. And that kind of safely mixes things up without destroying anything. And now we have that done. So now we have a 1 to 5 dilution. We need to make a 1 to 50 dilution. So that means you need to be transferring some sample or some fluids. So I'm going to throw away this pipette tip and get a new one.
Yeah, while he's doing that, so in my old job when I worked in the lab, I got to do all this much pipetting. So you'll see him pipette a lot. That's what my job was, pretty much like all day with a lot of pipetting. So if you like a lot of like repetitive, organized math, this is a great job for you being the pipetter.
I think we're all a little bit more, what's the word, animated for this kind of job. If you guys have picked up on that yet, but yeah, it's a very fun.
Pipettes aren't as fun to talk to as students are.
That's true. So going on with this, so we have a 1 to 5 dilution, and we have 900 microliters of our buffer in the next tube over. So how many microliters of our original sample would we need to make this 1 to 50 dilution? So how many microliters do we need to go from 1 to 5 to 1 to 50? See if anyone has that. 100.
Tyler says 100.
And Tyler would be correct. Thanks, Tyler. So by diluting or by adding 100 microliters of our protein into 900 microliters of this buffer, we're essentially diluting it by 10 times the amount. So we'll go from 1 to 5 to 1 to 50. Why wouldn't we take 20 microliters from the original stock and dilute it to 980 instead? And that would be because 20 up to 1,000 would not be a 1 to 50 dilution. That would be even more. Oh, wait.
It is a 1 to 50 because it's 20 into 980, but it's not as precise because the 20 is a lot smaller of amount than the 100. And with pipettes, the smaller the amount it gets, the less precise the pipette is. It does better work at bigger numbers. So when you can do bigger numbers, you try to do bigger numbers.
And this is why we are a dynamic team, because Alex catches all of my mistakes. So look at that.
No problem.
All right. So we're going to take 100 microliters of this original. Oh, wait, I got to change this. I got to get a pipette tip first. Change this to 100. Push down on that button. And then we're going to get our first 1 to 5 dilution. And then we're going to push it into the second tube. Then we'll go back over to the trash can and repeat this. So this is where Alex was talking about kind of like that repetitive nature of this. So we'll grab a new pipette tip. It's already set to 100, so we'll just press the button and go into our second tube. And do the third. It's a lot more fun when you can actually do this in person too. But this is a very, very good look at what the whole lab actually kind of looks like. So it's really cool. And done. All right. And are we continuing with the last part of this, guys? Or are we just doing the pipette part? What do you guys think?
Oh, we have some time. Go ahead.
Okay, sure. Okay, cool. All right, so I can see that. So once we've done that whole dilution, now we can actually go ahead and look at the proteins, because the problem before, if you guys remember, is we had too concentrated of a protein sample, and now we have a much more diluted sample we can actually look at. So now what we're going to do is get rid of this pipette tip. Come on. And put the pipette back, because we need to transfer 10 microliters of each solution onto a microplate. So we need the smallest pipette we have here to grab 10 microliters. Push down on this. Oh, I need a pipette tip first. And then we'll start with the 1 to 5 dilution. And this is a microplate, so this is going to go into a reader later, and we'll actually be able to use that to look at our proteins. Ah. Oh, Labster. So has anyone actually used one of these? If you guys can go ahead and put that in the chat, this is kind of like a tedious step. Has anyone actually used a micropipette before? Yes, Alazar, I kind of figured you did.
A couple people in the chat said they have.
Ooh.
Ooh, someone said me. Someone is kind of a little confused, huh? Someone said I have. This is awesome. For those of you who have used it, imagine the first time you used one, and then how much of an expert you became after. Because the first time I used the pipette, I remember I was in the community lab in 2006. Yes, 2006, for those students who were just born in 2006 and that we teach. So it's amazing just to see how we can actually get into that, because I didn't understand it the first time I used it. It was more of a repetition and then exploring that understanding over time. And, you know, when we teach it in the community lab, you know, we typically don't expect you guys to understand the whole thing just yet. So it takes a few minutes, it takes some time, and we want to make sure that you guys are always and consistently thinking about that. So I can tell you very honestly, I had a struggling time learning how to use a pipette or understanding the pipette itself, because to go from 1 liter to 1 microliter, okay, now it's a million factors, not 1,000 that we're used to. We're all used to 1,000, you know, milliliters make a liter and all that. So it was a very unique time.
Yeah, it probably would have been easier to learn how to use a pipette if I would have been able to do it virtually first, I feel like.
Probably.
Yeah, then you probably won't get as frustrated in person because you have to press all the buttons in here and everything. It probably seems like a cakewalk in person.
Yeah.
Oh, I have to press the button down. See, because you have to press the button down every time, and apparently my mouse doesn't like to do that. I always just go straight for the die. All right, so now that's all done. So now what I was doing while Alazar was kind of giving his little talk right there is I was adding this thing called a protein dye to all of the samples. And what this does is it's going to stick to all those proteins that are inside each of the wells. And when you think about it, we had the same amount of dye to each of these wells. And that's going to be very important in a few minutes. I don't need to hit myself yet. All right. So we put this pipette back after.
So this is going to show you guys kind of like an example of when you would use a pipette. So what we're doing is this experiment using these pipettes, and we're going to get to use a computer to look and see what the results of the experiment are. So this is exactly what it would be like in a lab. You would be using the pipette to add a bunch of stuff to whatever your experiment is, and then you could see the results of your experiment, usually using some kind of a computer, some sort of instrument. So this is going to be an example of exactly how it looks in the lab.
Yeah, exactly. So now what I was getting to first, but I wanted to wait for a second, is this. So as we add this stain, it's going to change colors. It goes from this brown color to this blue color when it comes in contact with proteins. So if there's more proteins in a sample, do you think that sample is going to look more blue? It's going to look more brown, stay the same? What do you guys think? More proteins, what color would it be?
The blue dye stains the proteins. So if you have more proteins, Tyler says it'll be more blue.
Blue color intensifies, and that's correct.
Yeah, exactly.
So now that we've had that shaken a little bit, not stirred, of course. It's a James Bond movie, right? We're going to take it over to Workbench 2, where we can actually look at that. Look at all the samples. Open this
We
up.
lost you on that dad joke there, Connor.
Oh, man.
Yeah, so this is an example of an instrument that you would use in the lab. It's called a microplate reader. So it's just like a really fancy little computer that you can put your experiment inside of, and it kind of like shoots lasers and measures how much blue you have, which is pretty cool. Another invention that people invented for biotech and chemistry. Chemists use it too.
All right, and I will look at our results. So in the first tab, we have raw data. You can see what the absorbance is, which means how much light was absorbed by each of those samples. In the second tab, we have the standard. Standards are super important to all experiments because we need to know if we're doing something and if it's like actually being done because of what we're doing. So we need to make sure that things happen always or things don't happen always, and those are like our positive and negative controls.
Yeah, when I think of standards, I think of a ruler, because basically it's just something that you use to measure whatever you're trying to measure. So we kind of basically made like a little chemical ruler, which is kind of cool.
All right, so now this one's saying, what is the range of our second tab? So there's a few ranges here. And I'm assuming it means this one right
So
here.
you go to the standard up there where it says raw data beside that.
Oh, there it is. I couldn't see that up there.
Yeah. There's our ruler that we made. So cool.
Yeah, and you can do a whole bunch of
that's one
different fits.
loppy
You can do
ruler.
like a, oh, I don't want to do that. What'd you say, Alzar?
I said that's one loppy ruler.
One loppy ruler.
It's pretty straight. Give
It's
it
like
a
the
break.
line of like, they call it the line of best fits. So it's not supposed to be exactly straight, but it's gonna, or it should be straight, but it's gonna kind of miss some of the points. It'll kind of go in between all of them essentially. That makes sense. It's easier to do that when you do math class. So what we're looking for is what is the range of our concentrations? So if we look here at the bottom, we can see our ranges right there. So it's gonna be 0 to 0.6. Oh, I'm not right.
No, it's 0.08. This is a little bit above the 0.
Oh, I thought it meant what is the whole, okay, never mind.
Yeah.
See this
It's
once
a
again,
little
Alex.
bit above, like that first dot is just a little bit in front of the 0. It's 0.08. That's how small it is. That's why we have to make this ruler, because it's tiny numbers.
Mm-hmm. And now I need to look at which BHL dilutions fall into this correct range. So we'll go back to over there and we'll come over to the raw data.
So basically we're just trying to figure out which letter falls between the 0.08 and the 0.65 in those blue numbers.
And it looks like it's going to be the last one on the way, very end.
C, I think it's C.
Is it C?
Because
So-
the 0.12 and the 0.14. Emiliana agrees with me.
Yeah, that's it. That's totally right.
Let's go, Emiliana.
And now we need to do this linear regression stuff, which is a biostatistician's favorite thing, I think. I did not like that stuff. So now we need to go over to the standard, and then we're going to look at, is it?
We're going to try to figure out which line fits these dots the best, basically.
Oh, okay, won't let me do that. Okay, so let's
Well,
do,
I think it'll only let you see linear.
is it only linear?
Yeah.
All right. And so this is that line I was talking about. So it's not going to hit all those points, but it's kind of in between all of them. It's kind of like the line that fits this graph the best. So just take a look at it, and that's kind of like, you know, what yours would have looked like, where all your concentrations line up with all your proteins. So can we estimate the concentration of BHL in 1 to 500 dilution? Finding the concentration on the curve will actually allow us to do that. So if we do,
Yeah. So this is where we get to use our ruler.
Right. So what we do is, was it 0.7?
It was so the absorbance was like 0.12 ish. I think it's 0.13 if you averaged. So you
Okay.
were trying to figure out the absorbance is 0.13, what the concentration ends up being.
So the absorbent, so the way you guys would do this, if we have an unknown, which is going to be down here, we know the one on this side, we can go to 0.13, which would probably be about right in the middle or
Yeah.
so, just a little bit above the middle. And then you'd walk all the way over to where it meets the line. And then you go straight down. And that looks like it's probably about somewhere between 0 and 0.15.
About halfway between, I'd say.
Quite.
It's 0.07.
0.07, that's what I think.
And you'd be right.
Yay!
And now if the dilution is 1 to 500, what is the original concentration? So now to do this, we just multiply that by 500 to get our original concentration, which is, add 2 zeros.
Carry the
I think someone
one.
answered.
Well, this is
C or
hard
B, we'll never know.
Emelina.
Ooh, we tried the first one. Oh, you said C first. I probably should have said. Ooh.
It changes like numbers every time.
Oh, did it? All right.
I did.
I would try C this time.
All
Woohoo!
right. Oh, yeah, we were working with corn. I kind of skipped that part at the very beginning, but we were working with corn. That's why it says something about a corn cob right there. And this is just some finishing up stuff. But yeah, that is the lab, and we are all done. Apparently I didn't get a perfect score, but Alex helped me get a more perfect score because I kept failing on some of those things. And that was our labster.
Yeah, so this is just an example of a way that if you were working in a biotech lab, you would use a lot of different instruments. You now see that you would use a lot of different kind of science, right? We used math. We used some computer knowledge. Connor mentioned we used some statistics to figure out how to make our line. We did some chemistry, right? We like added some chemicals together. We used a buffer. We did some biology because we were looking at proteins. So when we think about STEM and we think about biotech, you know, you can be interested in a lot of different areas. We mentioned inventions, right? How we invented pipettes. We invented these really cool instruments. So there's lots of different careers out there. Just looking at this really one, you know, simple lab experiment, we see so many different types of science going on. And that means there's a lot of different types of people that are needed. We need people that are, you know, really good at math. We need people that are really precise, that can use that pipette really well. They're really good with their hands. We need people that know how to use computers and people that know how to invent machines. So this is just an example of how you can see a lot of different types of science in this one simple experiment, even virtually. So when you guys are thinking about what you want to be when you grow up, there's not always just one answer. You can be interested in a lot of things that can work together to make some pretty cool careers. So you can consider biotech, where you can kind of do a lot of these cool sciences and engineerings and maths to work together to solve a problem that'll help people. See, Elena says she wants to be a lawyer. We need those. We've already talked about, right? So does anybody have any other questions about virtual labs, about real labs, about careers? I think we have about 10 more minutes. So we are available for any questions that you all have for us. I think someone asked, well, someone says they like the virtual lab better than the real one. It's a lot less pressure, right? It's kind of fun to be able to like play around with the computer and not have to worry about messing up the expensive instruments, or it makes you feel more confident before you go into a lab, I think. I like it too.
And you can do it in your bedroom or in your living room. Just sit there.
You can sit there in your pajamas.
Yeah, it's great.
And the lab safety one, it's like kind of like a cartoon where you like, you know, if you've ever seen like a lab in a cartoon where you mix two chemicals and it blows up in your face, it kind of like sort of happens like that. So you get to like mess up, but not get in trouble for it. You know, it doesn't like actually hurt you. That's good.
Yeah. I think someone asked like how old Biogen was, and I put it in the chat, but we were founded in 1978. So we had a big 40th birthday party a couple years ago. So Biogen's a pretty old biotechnology company, right? Biotechnology has been around for a pretty good while. Not, you know, compared to some things.
Or one of the oldest.
Yeah. Chloe asked us, how does it feel to work at Biogen? I mean, I'll start this off and say, I think it's really, really cool. I think it's one of the, I worked in a grocery store. So everyone's from Massachusetts. I worked in a market basket my entire life. So until I got to this, so it's, you know, worlds beyond that. It's one of the coolest places. There's a lot of really cool people. It's super diverse. You can always like learn more. I'm from New Hampshire, so there's not a whole lot of diversity up here. So I got to go into this world where, like, you know, it opened up this brand new, you know, this brand new scope for me. And it was really cool. So it's a very comfortable place, very fun to work for.
Yeah, and if you guys want to check out more about Biogen, you can go to biogen.com, and you can see a lot of the things we're working on. I think that for me, that's why I get so excited about working here. We do a lot of really cool different things. Like I say, we make medicines for diseases that don't have any medicines, and that's really exciting to get to help these patients. We also do things like we care about the environment. You can go to our website and check out our Healthy Climate, Healthy Lives initiative, where we're going fossil fuel free to help the environment. And we do cool things like the community lab, where we get to work with students. So I love working at Biogen. I think it has a lot of excitement. So you guys can check it out if it's a company that you're interested in.
Hi, everyone. This is Karina here. I also work at Biogen, and I know we discussed earlier all the different roles at Biogen, science and non-science roles. So my role is around advocating for policy. So my department, we advocate from everything from STEM policy to making sure patients can access a lot of these breakthrough therapies that Biogen creates. So meeting with legislators and just working to support the strength of our industry. So just wanted to share just another one of the many roles at Biogen, but of course linked to the science as well.
Thanks, Karina. Yeah, it's an awesome perspective. Yeah, we have a lot of people that aren't necessarily scientists that get to do a lot of really cool things too. So like Karina, working with government affairs, and that's something you maybe don't think about when we say biotech company, but that's a really important job. That's really cool.
And I agree with everyone. I think working at Biogen is, you know, I've been here for a little over 6 years now. So it's a very great company to work for if you're interested in learning something new every day. I think we all get a chance to do that. And then on top of that, I think having a science background and then being in the role of now kind of outreach and science education and being, you know, on the table with discussions around how to get access to science education for students all over the state of Massachusetts. I think that's such an important part of that growth that I've always wanted. And I think it's so important to be able to have a voice for STEM education, but also for young people. So it's wonderful just to kind of see that, and then to see how Biogen kind of fits that into its core value of caring deeply. Like, honestly, I think that's one of my favorite things about working at Biogen, is really being able to see how we really use our mission statement or our credo to always chase after what it is that we want to have as an industry. So.
Yeah, and so we have another question. How old do you have to be to work at Biogen? So 18. We do have college interns. So if you're in college during the summers, we have interns that come in. The community lab has some. We have some in labs. All over Biogen, there are college interns, but you do have to be 18. And you can find that on our website, usually around right before the summertime, when people can start applying for those. And then a normal, like, not intern job, you would need to be 18. We also have someone that says they really want to go to MIT. We love working with our MIT colleagues. We have some of those people on the line, Lee and Steph and Sam. MIT is a great school, and it's a really good place to learn all about STEM, and like all the different aspects, kind of how we talked about today. I think they do a lot with like where all these different sort of sciences meet, and how maybe like manufacturing meets chemistry, or, you know, all these different things. So I think it's a great place to go. If you are interested, you should look more into that and definitely consider that.
Plus, if you go there, you're right down the street from us. So, you know,
Yeah, you
who would want to be closer to Alzar and I?
Alzar and Connor. I'm still a few hours away. But.
Just a few by plane.
Thanks, Gina.
Thank you, Gina.
It was Emiliana that wants to go to MIT. All right, we have a couple more minutes. If anybody has any last minute questions before we leave you all, you can put those in the chat now. Want to make sure we get any questions you have answered. If not, if you think of something later on, if we said something that gets you thinking, like Alzar said, you can email us at communitylab@biogen.com. If you look in the chat, that was typed earlier as well. Connor, can you type it again?
I'm doing it right now, yeah.
Awesome. So send that email. Any questions that you think of about anything that we talked about today, or if you need any advice or thoughts about working in biotech or working at a company like Biogen, we'd be happy to help you.
What is our favorite thing about biotech? I think my favorite thing is like working with DNA and stuff like that. I mean, you get to work with like, you know, mammalian cell DNA, and you get to work with bacterial cell DNA, and like, you know, there's gene editing and all that stuff that's kind of emerging now in the biotech field. I think it's my favorite part is like, yeah, just the DNA and working with that stuff is kind of cool.
Awesome. My favorite part would have to be simply the fact that there's just so much innovation happening in biotech. I think being in Cambridge, you also see a new biotech company start every single week, at least pre-COVID and pre-pandemic. We really were seeing a lot of that. And I think that's because everyone has an idea and everyone has a thought. And it always starts with the thought of either an invention, as we said earlier, or it's a potential therapy or potential research opportunity that will really allow for us to change the world. So, yeah.
Yeah, and for me, what I like most about biotech, similar, I think, to what they said, is the fact that there's a lot that we don't know about biotechs. There's a lot of things that we can figure out. There's, like I mentioned, there's a lot of diseases that there aren't any medicines for right now. And biotech is helping us come up with these things that we've never been able to do before. So it's pretty exciting. And then we have another question. Joanna is a 6th grader and interested in chemistry, so she's looking for some advice. Well, I can start. So I myself was super interested in chemistry when I was your age. I loved chemistry. When I got to high school, I took honors chemistry, and then I took AP chemistry, and I did all the chemistry I could possibly do. I loved it. So I'd recommend doing that, right? If you think you're interested in it, look at what your school has to offer, take the classes they have, explore it more. And then also you can explore, other types of science too, because there's some types. I got so focused on chemistry that I really didn't do tons of biology and tons of like physics in high school. And then when I got to college, I started doing some of those classes, and I really liked those too. So I ended up majoring in biochemistry, which is really cool because it kind of marries biology and chemistry together. And that was what I was really passionate about, and kind of how I got into biotech. So yeah, I super recommend figuring out what your school has to offer, exploring chemistry more for sure, because it's awesome. But explore other types of sciences too, and you might find that there's a lot of really cool things where you can use chemistry in all kinds of different fields and different companies and different ways that you can help the world. So look into that.
Yeah.
And then there's another follow-up for you, Alex. A
Okay.
follow-up is, did you ever participate in science fair or engineering
Did
fair?
I do science engineering fairs? No. So let me tell you a little bit about myself, just so you guys know.
We
Here we
open
go.
the door. Let's
Yep.
do it. You
on.
have
In case
literally
you
30
missed,
seconds.
okay, 30 seconds, in case you have missed this from how much I love talking. I was also really involved in speech and debate when I was in high school. So like every weekend I was going to speech competitions all over the state of North Carolina. So I did a lot of science in the classroom, and then out of the classroom I did a lot of talking. So that's mostly what I did. But I do think they're really awesome if you have some science fairs nearby. I think it would have been really cool if I would have got to. I just had a lot going on. I also did a lot of cheerleading competitions. I was a very busy high school student. I was really into a lot of things, but you should for sure do science fairs if that's something that interests you. But you don't have to only do science. Like when I went to college, I got my biochemistry degree, but I also got a minor in dramatic art. And clearly I can be dramatic to this day. So make sure you follow all your passions. You don't have to follow just one. You can find a place in this world where you can use all of your passions to make the world a better place. I think we're at time.
Yes, indeed.
Like I said, if you think of any other questions, shoot us an email. We'll be happy to answer them. We want to thank all of you for being with us today. Kiera, the MIT team, the rest of the Biogen employees, and then especially all the attendees. Thank you so much for coming and having some fun with us and doing a little bit of virtual science. We look forward to hearing where you guys go in lives. I'm sure you all have super bright futures, and I'm really excited to see what you do in maybe biotech in the coming years.
All right. Thank you,
Well said.
participants. Bye, everyone.
Bye, everybody.
Bye, everyone.
Bye, everyone.